The treatment of heart valve disease is very comprehensive here at the Mayo Clinic and involves from medical management to surgery and everything in the middle. It starts by a comprehensive evaluation by a group of cardiologists with expertise in valve heart disease, and then a decision for treatment based on the complexity of the disease is made.
There's been a lot of emphasis on really doing evaluations with the patient still at home. And that starts as soon as they reach out to Mayo Clinic. We try to connect with them within 48 hours and have a nurse practitioner or a physician assistant do a video or a phone visit to really understand what is it they need from us, what is their current health status, and how can we best help them. You know, from there we spend time making sure that we get the latest testing they had done locally, that we have copies of that, we have images of that, so that when we get their record to the cardiac surgeon, they have all the information they need to make a determination of what are the next steps for that patient.
Over the last several years, there has been a development of new ways to treat valvular heart disease, and the tendency is to treat patients with less and less invasive approaches. The family is a key component of the process. Before the surgery, they are very helpful to reassure the patient and help to relieve their anxiety and the uncertainty. It's always important that the family understand, as well as the patient, what the procedure involves and what the goals of the procedure is and what the risk of the procedure are, as well as their recovery time.
We try to set them up for the best results post-operatively. We provide them with a lot of education and a lot of information in the preoperative setting. It's a very overwhelming experience to be told that you need cardiac surgery. It is routine for us, but not for that patient. And so we appreciate that they often need to hear the information more than once, and they often need multiple times to ask questions so that they thoroughly understand the cardiac surgery experience. The day of surgery, we try to keep in very close contact with the family members. So as the patient goes into surgery, we have a texting app that will reach out to the family at various times during the surgery and give them updates like incision, procedure started, on cardiopulmonary bypass. It's part of our job to keep them up to date and really to build that trust with the family that we're taking good care of their loved one.
After surgery, the patient normally goes to the intensive care unit, and the typical stay in the ICU is around 1 or 2 days. After the patient goes to the ICU, it is moved to the progressive care unit, and the typical stay there is about 5 to 7 days. With less invasive approaches, the length of hospital stays is substantially shorter, and the average length of stay for those procedures is around 3 days. After the patient goes home, it is very important that the patients remain active, that they have good rest, good nutrition, and that really speeds up the recovery process. We expect that they should be able to get to a normal functional state about 4 to 6 weeks after the surgery.
Patients come to us, they're not feeling well, they're struggling with even their activities of daily living, and a day in the operating room, we can fix their heart valve or take some of their heart muscle out, and they wake up feeling new again. They've got energy that they haven't had in years, and it's just fun to see that transformation and to see them leave the hospital feeling so much better than when they came in.